Hello, my name is Brittany Shegley, and I'm a student physical therapist at Campbell University. Today we are going to talk about strain counterstrain of the piriformis muscle. Strain counterstrain is a passive technique used to treat musculoskeletal pain and somatic dysfunction. Myofascial tender points are located, and in this case, they're directly over the piriformis muscle, which is a deep hip rotator located below the glute maximus, and then monitored while the patient is placed into a position of maximal muscle relaxation and shortening. It is believed that strain counterstrain affects the muscle spindle by allowing the extrafusal muscle fibers to relax and lengthen to their normal relaxed state when they are in a position or when they are in a spasm, or if there is dysfunction. This decreases the spindle output and interrupts the pain spasm cycle, while also increasing blood flow to the area that was previously ischemic. To locate the tender point or strain counterstrain of the piriformis, you want the patient to be laying and prone. You're going to assess it by looking for the PSIS and the greater trochanter, and then you want to meet in the middle. That point underneath your finger should be where the tender point is located. So for this, with strain counterstrain, you want to assess both sides. So we'll start with the right, and you're giving just enough pressure to blanch the tip of the fingernail. Once you've assessed both sides, you want to see which one was more painful, and this point is going to be about 4 times more tender than the tissue around it. For the sake of this video, we're going to go with the patient's right side being the tender side. So we reassess and find our spot. This spot should feel edematous under your finger and maybe tense. It definitely has a different tissue characteristic to the tissue that's surrounding it, and the patient will tell you as well. So while keeping your hand on the tender point, because you don't want to lose it, you want the patient to be close to the edge of the mat, because you're going to be taking their leg off of it, and then angling their body a little bit away so that it's more comfortable for them. This is a completely passive technique, so you want them to be as comfortable as possible. So you take their foot off the side of the mat, and you want their shin to rest on your thigh. You're going to passively flex them 90 to 120 degrees of hip flexion. If they're unable to, that's okay. Just go as far as you can. Once you're at the point where you feel it kind of give way under your finger, it should, as the muscle shortens, it should start to relax, and you should feel somewhat of a difference. You want to abduct the hip out, and at that 90, once you're past 90 degrees, you internally rotate the hip. If they don't make it to 90 degrees, then you would externally rotate the hip. So she's past 90, so we're going to internally rotate the hip. Then from here, you want to make minor adjustments in flexion, abduction, and internal rotation until you feel the mobile point, which is when the tissue completely gives way and relaxes under your finger. The patient should also feel no pain at all. It should be completely comfortable. How does that feel?
Feels better.
Once you're in this position, you keep your thumb on the tender point, but you want to release all pressure. So you just want to have it there for contact. Hold for 90 seconds. Okay, 90 seconds is up. Once you're done with that, you're going to completely passively return the leg to the starting position. So you don't want them to help at all. So just completely relax. Okay. Now that she's returned, you want to reassess the tender point. When you reassess the tender point, you want it to be at least 70% better than it was when you started. The whole point of returning them passively is so that they don't undo everything that you've just done with them. You don't want them to contract the muscle at all until you've been able to assess it and make sure that your technique worked. It is thought that there are points throughout the body where muscular dysfunction and pain can present itself. These points are called tender points, and it's kind of similar to like a point in the muscle where it's really tight and there's some tissue that just isn't the same as the tissue that's around it. This technique is going to put the muscle in the most shortened position that we can passively, so I don't want you to help at all, so we're not going to use your muscles, and we're just going to relax there for about 90 seconds, and it's thought that this is going to allow the muscle to kind of reset itself, therefore eliminating all of the pain and the dysfunction that you've been feeling. So hopefully we'll get you feeling better and be able to move a little bit better. Okay, do you mind?
Mm-mm.
All right. Okay, which side hurt worse?
This side.
So if you'll just scoot this way. Alright, and then angle your body to the left a little bit. Alright, and just relax. Okay, how does that feel?
That's better.
Do you have any pain?
Mm-mm.
Alright. We're just going to stay here for 90 seconds, so relax. It's been 90 seconds. So I want you to relax, so like bring your leg back up onto the table. Don't help me at all, okay?
Okay.
Okay. And now I'm right here. Now I'm just going to recheck these tender points, okay?
Okay.
How does that feel?
It feels better.
Better? Would you say it's at least 70% better?
Yeah, I think so.
If it were not 70% better, we did something wrong in our technique, whether the patient wasn't relaxed well enough or we didn't go far enough. So we'd have to re-perform the technique, but in this case it's good. A positive finding with this test is that pain that you felt where it was a lot more tender than the rest of the body. And I would also want to look for a grimace on your face or some sort of indication of pain.
Mm-hmm.
When it's painful, you'll definitely know it and it'll make you want to jump off the table, unfortunately. But the good thing is that we're able to make it feel better with this technique. So do you have any questions?
I think so.
Okay, well, thank you.
Thank you.